I'm Liv now with Parents at Go, and with me today I have Dr. Stein, who has been a pediatrician, a developmental behavioral pediatrician, for the past 43 years. You see a lot of new patients, brand new babies, and you see the parents with them as brand new parents. What do you see that's different maybe about a new parent in their emotional behavior or physical, or even like physical being?
I don't think as adults we're put on planet Earth to know how to parent.
Yes.
That it is something we learn as adults. Before modern times, all parents, all women in particular, had their mothers, their sisters, their aunts, lots of people around.
Someone to
help them. Now, at times it could have been overwhelming, but they had other people to give them advice, to give them respite care, when they needed it, take the baby for a little while, and to give them direction. One of the earliest pediatricians to write a book that was a parent guide in modern times is Benjamin Spock. He wrote a book called Baby and Childcare. First edition was published in 1946, just after World War II, and it was gone through like 10 editions.
Wow.
And for many years, it was by far the most popular parent guide, and still is around and very popular. Well, he has started each of those editions with the words, "Trust yourself, you know more than you think."
Oh, actually, yes, I saw that quote. I like that.
Trust yourself, you know more than you think you do. Yes, that's the complete quote. And that's such a simple phrase, but it's really true. That his philosophy was it's important that parents first learn to trust themselves.
And for those times when they do need advice, when the mom or the dad do need advice, do you have anywhere that you would recommend for them to seek that advice other than their pediatrician?
Well, one is Dr. Spock's Baby and Childcare. That's still, although he passed away, now 15 years ago, it's still a very good book, and it's been republished by other people. There's another book by Dr. Brazelton that's very good. His original one was called Infants and Mothers, which I think is his best, and it's a little hard to get, but it's a wonderful book where he takes each month of the first year and talks about just normal children, the range of normal. He talks about the very irritable baby, the very quiet baby, and maybe the 70% that are in the middle. And he explains how they're all normal, but they can appear very different. And he shows how that changes each month in the first year. Now, a more recent book that Dr. Brazelton has published is called Touchpoints, and that's available in paperback. I like to send people to the American Academy of Pediatrics parents website, which is very good. There's one called Babycenter that's very good, particularly for young infants.
Yes, I've used that one.
And there are a few others, so that can be helpful too.
If you have a difficult, more than average, terrible to child with a temper, how would you, what would your advice be on how to handle that kid? Like, let's say they threw a tantrum because, I don't know, you didn't give them the right cereal.
Sure. Well, I have several ways of approaching it. One is to help parents to appreciate that temperament is something inborn. It's not necessarily something they're directly responsible for. It should be feel guilty about. Number two, that if the parent's temperament is very different than the child's temperament, that may create a lot of disharmony. And getting in touch with that as a parent can be very helpful.
Right, because the parent doesn't understand what the child is going through or feeling.
Yeah. I mean, if you have a very calm child and a very hyperactive parent, by nature, that could be a clash.
Right.
You can't expect the child to understand that difference, but the parent can understand.
Well, did you have anything else you wanted to share with us?
Maybe just one thing, before we were talking about child abuse and how we can kind of prevent that.
Yes.
And, one thought I'd had is that there's a colleague, Ron Barr, who's a developmental behavioral pediatrician, who's done a lot of research on crying.
Mm-hmm.
And what he realized in the last few years that is most of the cases of this very severe form of child abuse, physical abuse, the shaken baby syndrome,
Mm-hmm.
when parents out of control just take their little baby infant and shake them, and that causes bleeding
Yes.
in the brain, and sometimes that's irreversible brain damage. Well, most all of these episodes of shaken baby syndrome occur when a child has been crying for a long time.
Mm-hmm.
So, here Dr. Barr, who's kind of the world experts on baby crying, was saying, well, what can I do with my knowledge of this
Mm-hmm.
to maybe develop a program that makes a difference? And so he's developed a program where in the nursery, actually, the parents get a videotape and some written information on just what crying is,
Uh-huh.
what excessive crying is, how all babies cry, and some cry more than others,
Mm-hmm.
and how at times a parent needs to kind of get in touch with their own response to it,
Mm-hmm.
and that time out for parents is often the best treatment.
Right.
Now, that's a new concept for a lot of parents. Time out for parents? Well, yeah, time out for a parent. When your baby is crying and you pick the baby up and you try shaking the baby gently, still is crying,
Mm-hmm.
you check the diaper, it's not wet, nothing is tied too tightly on the baby. Baby just won't settle. And you've done all the things to try. Put the baby down in the crib in a safe place and take 5 minutes out. Take your time out.
Yes.
Cool down. Cool down.
I think that's the best
Such
advice.
a simple, it seems so simple, but it's something that still has to be taught.
Yes. No, I have to say I've used that myself because one of my babies was crying a lot when she was little, and I didn't know what to do. It was a very long time, and I thought I was gonna, I was just losing it. I had no other ideas, and I felt guilty about putting her in the crib and and taking my time out. But then I thought, you know what, she'll be fine.
Yeah.
I'm gonna put her in the crib. I'm gonna leave for 2 minutes. Nothing's new is gonna happen. And I went to the bathroom, washed my face, and it was like a different story afterwards.
You felt better and the baby still crying.
Yes. I felt better, but they feel what you feel. So it's like if you're more calm, then there's a better chance for them to be more calm.
Yeah, no, that's a good message too. They do feel what we feel.
Yeah.
Babies pick up on our emotions.
Right.
Even very young infants do.
We think it's all in our head, but
No.
they can feel it.
They do.
Okay, well, thank you, Dr. Stein.
You're
I
welcome.
appreciate you taking the time to
It's a
talk with
pleasure.
us.
Pleasure.
And thank you for watching.